The more frequent failures in terms of associate integration that we see are usually because of a misalignment of expectations in the beginning. Culture is about so much more than money. It's more about transparency. How are we communicating with each other? And then how are we not just holding each other accountable, but also praising each other in the way that the team members appreciate it? There are pros and cons to literally every leadership style that's out there. Nobody is a perfect leader. We all go through that journey, and I believe it's a never-ending journey.
My goal is to share insights and business strategies so that dental professionals like you can grow your company. My plan is to grow this podcast to reach and support more people in our field. If you haven't yet, please consider subscribing. It helps the show grow. Plus, I don't want you to miss an episode. Thank you for being a part of the journey. And we are back with another episode of Nobody Told Me That. And in my time-honored tradition of bringing on friends, I have Olivia Smith, who I've known for years. Olivia Smith with Olivia Smith Dental Consulting. And she's going to come here today to talk about all sorts of things management. We're going to take a little bit of a break from RCM because what she does is pretty cool. And I want you guys to hear about how she works with teams. So Olivia, what's shaking? How are you?
I'm great. Thank you so much for having me. I really appreciate it.
Yeah, we reconnected at CE on the Beach. It's been a while since we've seen each other. So CE on the Beach was in the Caymans this year, and that was a lot of fun. And you've gone before, or was that your first time as well?
It was my first year going. It was really fun.
Yeah, I really had a good time. So we bonded, I think, next to the fire dancer. That was pretty funny. So, but I know you from years ago. You were doing some practice management consulting. You were doing some medical billing. And I know you've moved away from that, but you're still really good with RCM and the codes and all of that. But you really have been kind of drawn to the management side. You were with a very large consulting company. I mean, give us a little bit of background and then we'll dive into your little nuggets.
Yeah, for sure. So I started in dentistry back in 2014. I was still going through college at the time and really just fell in love with practice operations and very quickly was into management like a month or two into my role. And it was a mom and pop shop, really small private practice. And he wanted me to grow it, which is what I found myself learning about every aspect of the practice, not just, the admin side, but how does the clinical team work, learning about hygiene, learning about the doctors and how they diagnose and just really all aspects of the practice, which led me to really fall in love with practice management. So I worked there for 8 years, I believe. And then I'd started consulting on the side a little bit. At that time, and we were growing to multiple locations. We had other companies we were working with. It was getting really big. And then I felt like I had outgrown being in operations and I felt like I was really enjoying the consulting piece. Went to work for a friend at the time, helping with medical billing and enjoyed that as well. But I realized I enjoyed more of the teaching side of it. I wasn't really as passionate about the actual billing part. I can do it and I'm knowledgeable in it, but it's not, not what gets me going in the morning. And I was also recruited by Spear Education at the time. So worked for Spear for several years in their consulting group and got to work with over 100 practices across the country in my time there, learning a lot more about KPIs and industry standards and how working with some DSOs, working with private practice. And I just really felt like I loved private practice. I knew that that was my calling. And at the time, their program was changing. So I had to really look at what I wanted to do with my career. And I really wanted to be able to offer more boutique consulting for those who really want hands-on, customized approaches. So I started my own company. So
Nice.
yeah, it's been a lot of fun. I have clients all over the country and really just enjoy helping them reach their goals.
So when you said KPI, so I always remember back to when I didn't know what any of these mean. And there's a lot of new listeners, new to dentistry. So KPI, key performance indicators, right? And these are the measurements that we use. I mean, there's so many. And I think, when I started, it was production collections. Let's keep an eye on adjustments, but let's make sure production collections is going really well. And then let's look at AR and make sure that's not out of control. But nowadays, KPIs are a whole slew of numbers that you need to look at on a regular basis. Is it tough for a dentist who's not really business minded? How tough is that for them to wrap their arms around, my gosh, I have to look at all these numbers? And when I grew up, my dad, like, this is what a doctor told me. When I grew up, my dad was the dentist. I knew I was going to be a dentist, and we just made sure we had money in the bank. And now you're telling me I need to look at this and this and this. And it's wild, isn't it? So, how do you broach that conversation? Like having a hard talk, like, you do need to know these numbers.
Yeah. So the way that I work with clients is I usually start off with figuring out one, where they're hurting, because usually that's why they're reaching out for consulting. And then we go into like, what are your goals? Because I can tell you things all day long that you should do in your practice, but if it's not important to you, you're not going to do any of it.
Yeah, yeah.
So I first start off with like, what is the most important thing that you're trying to achieve? What do you want your lifestyle to look like? And I have so many doctors that think that they're stuck in this one cog that they have to work, 4 days a week, or they have to produce this much, or they have to do X, Y, Z.
Mm,
And that's where the numbers are really fun for me because I can really peel back the onion and say, okay, what's going on here? I do an initial analysis where I look at all of their numbers and say, okay, here's maybe some areas that we can dive deeper into. But the numbers also tell a story that I think sometimes in dentistry, they get thrown around a lot. Like, oh, your recare is this amount, and so you're doing terrible. Well, maybe
okay.
not. Maybe you're in an area where, you have a lot of college students, or we expect your recare to be at a lower metric than we do other numbers. So really
Yeah.
understanding the story behind the numbers, asking the right questions, and then figuring out, okay, what are the numbers that are the most important that I need to focus on? If you
Yeah.
try to focus on all of the KPIs, you're just going to, or key performance indicators, you're going to wear yourself out. You won't focus on anything. So really honing in on those.
I remember a client had bought one of these dashboards and like he fired it up and did the analytics and stuff. And he's like, I am awful. I'm losing money. I'm doing this because all the numbers like came back. And I was like, you just calm down. Let's just walk through this. Let's just go. And but firing that up, I mean, if he didn't have someone saying calm down, like he probably would have been like, oh my gosh, I need to fire everyone. I need to bring this. And like it's very reactionary to look at numbers and see that you're not where you should be. So I think that's super important what you just said. Like you might have an underlying reason that you just need to have somebody point it out to you. What do you see with case acceptance? And is that a big, like, because I feel like people, they're like, I want to be more profitable. And I'm like, it's right here, but we just need to work it. I mean, do you see that there's just unscheduled treatment all over?
There is, and I feel like that's a two-part answer because the first part is understanding what that metric should look like.
Mm-hmm.
Because if you're an implant practice or you're doing even GPs that are doing implants and sleep and ortho, your case percentage is going to be a lot lower than a general doctor doing crowns and resins all day, right? Because
Yep.
you're presenting higher cases. So every no that you get is going to hit that number and percentage a lot harder. So, first, understanding what does your procedure mix look like? And then gauging, okay, not only are we presenting, because a lot of doctors are tracking, oh, here's our percentage or here's our dollar amount. And then again, they feel terrible about themselves. Like,
Mm-hmm.
why didn't I hit this? But then really understanding, like, what is your process? What do your handoffs look like? Why aren't people saying yes to get treatment? If it is financial, how are we presenting it? Is your team confident and comfortable with verbiage to be able into financial options? The thing I see the most is I go in practices and I have treatment coordinators that aren't comfortable talking about money. And the patient
Yes.
gets that. And then when we're presenting something like, oh, I'm sorry it's a lot of money, or I'm sorry it's expensive, why would they want to come to you, right?
Oh my
Versus,
gosh.
it's an investment in your health. Here's why this is so important for you. So
Yeah.
yeah, I find that there's so much out there, but it's really more around the training with the team and getting everybody to be on the same page and understand how much our words affect the patient's outcome. And even from the doctors in the treatment room being, here's my recommendation and here's why, and here's the risk of not completing it. And then stop. Don't ask
Mhm.
them, do you want to do treatment? They came to you for your professional opinion.
Yeah, that's really good. I love that because what I often hear is like the doctor is saying it in such a way of like approval. Like,
Mhm.
whatever you would like to do, whatever you would like to start with. It's like, no, when I'm going to a medical professional, I expect to be told, like, here's the best thing you need to do. But we're just nervous. I wish we
Mhm.
could take that nervousness away. Imagine going in and buying a house, and the real estate agent is like, okay, I know this is really expensive. I know. So let me know if you like it. Like, come on. That's not going to
Exactly.
work, right? But
Yeah.
yeah, if you're doing your service mix is super important when deciding that. I'm actually really surprised by how many doctors will tell me, I would love to do more implants. I would
Mhm.
love to do more of this. I would love to do more of that. And then I say, well, have you had like some focused training for your team? Because I'm not consulting anymore. So now this stuff just comes out like in questions, like, and so I just throw something and I feel bad because I throw something and they're like, oh my God. And then I'm gone. So, but like, why don't we do like seek out advanced training on
Mhm.
specifically implants and like really focus on the pros and cons? And then that kind of happens. But if you don't focus on that, you're always going to do the bread and butter dentistry, which gets the high case rates, like you said, because who's going to say no to just regular fillings? It's harder to get the yes on the other things.
Yeah. And I think it's putting in the work too, because a lot of doctors, I see this across the board, and it comes down to leadership styles and even like trusting and training your team. But oftentimes, I always tell everybody change is super uncomfortable. It will be uncomfortable. You're all going to want out at some point, right? Just like marriage, probably for most people. Like at some point, you're going to be like, this is hard. This is terrible. What did I sign up for? But stick it through because it's worth it in the end. So, what I come across is like, say, for implants, for example, we might go to all these implant courses. We might decide that we're going to do it. We might even focus on team training. But then when we realize that our exam flow doesn't support us asking the right questions or having enough time to diagnose,
Mm,
they'll pull back and say, oh, never mind. We're just not, we just don't have time for it. It's just not working. And it's like, well, we're not asking the right questions. Or if a patient, maybe we're doing a questionnaire for sleep in our paperwork, and a few patients grumble because they have to fill out more paperwork, which they always do, then the doctors will be like, well, never mind. We're not doing that anymore. So I think it's also realizing as a leader that you're going to have to be consistent and work through some uncomfortable times
mhm.
to implement what you truly want, which is where coaches come in, or just even making sure that you analyze that yourself before you get started. Like, no, where am I going to be uncomfortable? Where am I going to try to pull back, and just push yourself through it because it's going to be worth it in the end.
When you find a dentist who needs a little bit of help with leadership, and honestly, there's no shame in that. I find that to be very common because if you're a scientist, leadership is not what you were waking up every day to do. It's just not, right?
Yeah.
So it's totally normal if you find yourself like, okay, maybe she's talking about us. We might be, and that's fine. I feel like that is harder to coach that dentist if it's a full coaching thing. Like, do you find you need to separate the dentist out and do individual sessions? Like, I feel like it would be almost embarrassing for the dentist to be in like the leadership and training with the team. Or is it better for that? I mean, your style, do you separate them or do you do kind of a hybrid?
It really depends. I think that when you're coaching and working with a doctor, you have to be very careful with that respect because we want the team to respect the doctor as well.
Mhm.
So, if I'm calling something out or saying, hey, doctor, I usually try to do it in a way where we'll talk about it more later, more in
Okay.
depth, one on one. But it's more of, hey, I just want to reach out. Have you thought about it this way? Or, doctor, would you be comfortable with this team taking the lead? And what layers of accountability can we put in place for that follow up where you would be comfortable? So those might be some of the questions I would ask in front of a team. Usually, I work with a few doctors that are very interesting where they'll tell the team like, "Hey, I know my leadership stinks and I'm really trying to work on it." And so
I love it.
they're very open, and those are kind of easier because the team will start to call them out. But I always remind everybody that nobody is a perfect leader.
Mm,
We all go through that journey, and I believe it's a never-ending journey, right? Like, it's about, you're just going through the process of always trying to improve. But when I work with doctors, I do a lot of one-on-one, but again, it has to come from them as to where they wanna start. If I
mhm.
see something that's not helping them reach their vision, I'll bring it up in a way of saying, "Hey, like, when these things are happening, here's what I'm observing. And, here's how that I think that might affect your goals. What do you think?" And get them bought in because
Yeah.
I can come in and be like, "Oh gosh, you're a terrible leader," but that's not going to get them where they wanna be. So we do a lot of that one-on-one work together, but it is really challenging to look in the mirror, and I always tell everybody in the age of I'm a huge Simon Sinek fan, but when he
Yeah.
came out, there was all of this propaganda out where if you're not a servant leader, you're a terrible leader, right? Like,
Mhm.
but not everybody responds to a servant leader, just like not everybody responds to an authoritative leader.
Right.
So you have
Right.
to adjust your leadership. So I teach a lot of situational leadership style training on how you have to adjust to your team and not just their personality, but also where are they at on their training journey. They're going to need more handholding in the beginning. And then when they get a little bit further along, you can loosen the reins a little. So, we just talk through all those things and help them reach their goals.
It's a good call out, those leadership styles, because there is a lot of talk. And I see this like everybody on LinkedIn has servant leader, servant leader, servant leader. It's like a buzzword, right? So
Like, are
just for
you really?
I kind of and some of these people I know, and I'm like, "You're really not," but that's a different story. So,
Yeah.
just for the people who are not sure or maybe haven't read Simon Sinek, and his books
Mhm.
are easy reading, so I feel
Oh,
like
yeah.
they're great, and I'll link some in the show notes, but when you're a servant leader from Simon Sinek, what does that mean to you versus, like,
Yeah.
the authority leader you were talking about? Like, tell me those leadership styles, and is there another one that we should be thinking about too, as we evolve as managers and dentist owners?
Yeah, there's several different leadership styles that we could get really into, but that would probably take the whole time. But as far as the servant leadership, what he's talking about is really being focused on serving your people and finding out your why and sharing your why and being a visionary, which I am a huge fan of, right? You have to start
Mhm.
with the vision. That's the leader's role. But what some people interpret that to mean is that you cast your vision, you get out of the way and you let them do their job, which
Mm,
is more of a laissez-faire approach when you're
yeah,
talking about actual leadership
yeah,
styles. And so there are pros and cons to literally every leadership style that's out there. You're going to have a strength in one area, an area of opportunity, but if you know more of what your own leadership style is and you're more aware of, hey, I am a hands off leader, well, then you probably need to partner with an operational person that is more
right,
direct and can get the job done. Otherwise, your team gets frustrated because teams like accountability. They
yeah.
like to know everything that I'm doing, one, they care that I do it. And two, if I don't do it, it's going to matter. Right. So
Mhm.
a lot of times I work with teams where accountability is a huge issue and we figure out like, well, I do all this training, we do everything else, but nothing's getting implemented. Well, yeah, because nobody's following up or auditing or making sure something gets done. So
Yeah,
understanding your leadership style and that it's not necessarily a negative because you might be more calm in areas of stress if you're more laissez-faire. But if you are really focused on, again, I think some of those buzzwords, it gets confusing on like, how does that actually apply in my day to day? And what do I do if a situation pops up? Because now I'm really upset because somebody called in last minute and I've got patients waiting and whatever. And their reactions might not really follow what they want, what they truly want to be as a leader. So,
I think it's really important to have some sort of like a yin to your yang in there. And, we see this a lot with really successful managers and dentists, whether it's a team of dentists and one manager that's an implementer or, one on one type thing. There are some doctors who do that laissez faire, like they just kind of bark out a vision and then they go away. And the manager's like, yes, we're going to do this. And that's amazing. But then you have some where the manager is just like, and I kind of evolved into this like very let's get stuff done, holding accountable. And the boss is very much like, here's my vision, and we're all going to move to him and uplifting, and we want to do this. And so I think it's good to have the yin and the yang. It's hard when you've got two yins or two yangs, like two, who visionaries and nobody's doing anything, or two like almost like helicopter managers, right? And then
mhm.
nobody's feeling good about anything.
Yeah,
So it's really important to identify that. Have you run into situations where you're like, this is not going to work, these two together?
frequently.
What a nice
Very
way of saying
frequently.
heck yeah.
Yeah, those are always hard conversations. And sometimes with coaching, you start to see people change over time. And that's the really fun part of my job is, going in and helping somebody and helping them see, like, here's how you would have reacted in the past, but that's not serving you. What are your goals for the future? What reaction are you hoping? And oh, here's some tips and tricks. Like, I want you to try this next time and tell me how it goes. And so sometimes we can work through those things, but every once in a while, I do have someone where I'm like, okay, you can't have two people that are just not going to hold anybody accountable, right? And on the opposite, I can usually get the helicopter managers down a little bit to
Yeah.
calm down and realize usually those are more type A, or on the disc scale, they're usually like the C's, the controllers, like they want numbers, they want everything exact. I can get them to settle a little, but it's usually the too laid back that are really hard to
Yeah. Yeah.
to get them to hold anyone accountable.
And what I usually find, maybe it's different for you, but when I see those 2, like, he's like, "Yeah, we've been managing a long time, but we've had a lot of turnover." And it's like, "Well, yeah, you 2 are the only ones that stay on the island. Like, everybody else is rotating through because they see, like, there's a problem here." And so it's
Yeah.
always the other people's problems, the ones that left. Like, they're not the problem. The workforce is terrible. People don't have work ethic, all that kind of stuff. And it's like, well, you
Yeah.
know. So, and those are actually, unfortunately, those are the ones that really don't seek out coaching. So
Mhm.
I really applaud any dentist that realizes, okay, coaching could help. And I've very rarely heard from a dentist, yeah, it wasn't for me. If it was more of a smaller type coaching, I mean, when
Mhm.
you get to big coaching, there's very much systems operations, and some dentists really need that. But I feel like to go to the next level, like you really need someone that's going to be like checking in all the time
Yeah.
and holding them accountable. Talk to me a little bit about the culture nowadays in the office. I mean, maybe you're seeing things differently. I hear it from all over. I hear, team members nowadays are just so hard to work with. And then I hear my team is amazing. Like it's
Yeah.
so all over the board. One thing that has come up though is like on social media, there's almost like a lot of, everybody's trying to go viral. So everybody does these videos and it kind of makes the doctor look like a dum dum on these videos. Like they're kind of making fun of the doctor and stuff. And I always feel like
Yeah.
that's really weird. Is there like a culture of disrespect that you see from team members? Or is that something that when you have a coach team, you don't really see that? I mean, or do you just hear about it from other people?
I think it depends. I think it depends on the doctor's personality. If they're like okay and they're fun and they're a lot of offices where I see some of those TikToks and things happening, they're actually the ones encouraging it. They're the ones like, hey, we should do this. And then when you meet the doctor, they're like goofy and fun, and that's their personality, right?
Yeah.
So in those situations, it makes sense. I do feel like there is a little bit of disrespect going on in practices, and it's a generational gap where they don't understand like why does this person not care, but we're seeing the younger generations actually want more of a purpose, whereas we're just trying to throw money at people and say this is, figure out your own job, hands off, you do your thing. And they want to know that what they're doing matters. They want to know that they're having an impact. So I do see it in both sides. I see sometimes where there is just actual disrespect where we're like, hey, we have to deal with this, like you might want to sit this individual down, talk to them. If it's not the right fit, you can't keep them
Mhm.
on your team long term because it's bringing everybody else down. But usually, what I find in the difference between the teams that are like, my team's amazing, and oh, I've got all these sour apples I need to get out of here, is the leadership. And it really comes down to like, are you holding people accountable? Are you clear? How is our pay structure? How is our
Mhm.
which I work through that a lot with doctors. Like, do you have a pay scale, or are you just offering everybody what they come in asking for? And
Mhm.
then they talk and they figure it out. Like, I would be frustrated if I were working for $20 less than, the other hygienist next door and I've been with you for 20 years and now you're
Yeah.
wondering why I want to leave. So, just really understanding that culture is about so much more than money. It's more about transparency. How are we communicating with each other? And then how are we not just holding each other accountable, but also praising each other in the way that the team members appreciate, right?
Yeah.
I have some team members that, like, if I call you out in public, I know they're mad at me, and then I tease them about it, and I'm like, "I know you hate this, but you did a really great job," versus they might like a personal hand note or whatever that looks like, and it's easy to figure those things out and then
Mhm.
adjust accordingly. So, again, more
Yeah.
situational leadership, not just blanket, "I'm gonna do this for everybody. I bought lunch, so everyone should be happy." That's
Right.
not how it works.
Well, that's great, but the vegetarian doesn't appreciate, like, all the chicken that you bought, so, yeah.
Exactly.
Um, so it's wild, though, because when you talk about pay, that really gets a lot of dentists riled up right now because
Yes.
it's so all over the board, and I remember, way back when I was hired at such amount and pay
Mhm.
was going up and the new receptionist coming in made more than I made when I started out, but, I mean, that was 6 years ago, right? So I
Yeah.
had to readjust, but you do get a lot of that where like
Mhm.
they're just, how are they worth it? But everything has gone up and it's about how much you can afford, but also you got to keep an eye on the market. I mean,
Mhm.
so when you talk about pay scale,
Mhm.
if you could explain like how do you implement that or how do you even suggest that to a dentist who has been, and I think this is most dentists, like they ask for a number and they're like, okay, I can make that work. That's really not how we should be doing it. So can you talk a little bit about pay scale?
Yeah, I think it also goes into why are we adding a team member to start with? Because I think a lot of people don't know how to analyze their numbers and they just get busy and they're like, oh, it's painful. Let's add another person.
Mm,
Instead of sometimes backing up and being like, okay, well, could we restructure things and work more efficiently? the way
Sure.
that we have our team. Because if you need it because of growth, you need to make sure that your budget aligns with that. And sometimes it is an investment, right? To be able to add a team member initially and then you can grow into that. But usually with my clients, it's a little bit easier because I'm doing annual planning with everybody at the end of, right now, we're in the thick of it. At the
Yeah.
end of one year, we're planning for the next year, and that includes salaries. And we're looking at how much are you paying all of your team members. But even any doctor or owner can do this where you just sit down, look at everybody's pay, and then figure out you want that range. I usually say to be about $5, no more.
Okay.
Where if I bring in a new hire, I really like it to be like three, but if we're bringing in a new hire and they're starting on the low end, they don't have the experience, I can pay them at a lower range. And then as they grow and progress, I can increase that pay, right, up to the top of the range. Or
Sure.
if I have somebody that, like, oh my gosh, they come so highly recommended, even though they don't have as much experience, they might be somebody that can help lead the team. I can pay at the higher dollar end of that range. And then from there, it gets easy. It's okay, if you want more money outside of that range, there's got to be more responsibility, right? Here's what we pay for this position. And corporations are actually really good at this and they've been doing it for years and years. But for some reason, the dental field just has it. Even medical does it. They don't really
Yeah.
catch on. Like, you don't just get more money for being, you don't get a dollar raise every year you're here. But then at the end of the year, what we do need to look at when we're planning for our salary so that you don't end up 5 years where, oh my gosh, this person hasn't had a raise and now I have to jump them up $4,
Oh, yeah.
is
Yeah.
doing a cost of living increase. So I
Mhm.
always look up it's 2 point something percent this year.
Yeah.
Always look up cost of living for Social Security for the next year. You can Google it and it will tell you what the average cost of living increase is anticipated for Social Security. So once you get everybody in those ranges and we're happy, then you can determine, one, when you're doing your annual meetings with them, or I recommend quarterly meetings with your team to see how they're doing on performance. You
Mhm.
can determine, like, oh, hey, they're really progressing. I gave them a goal. They're doing this.
Yeah.
Let's bump them up in their range. But if they're at the top of their range and we're not adding any more responsibility, that's where it's okay. We got to keep up with cost of living so that we don't
Right.
fall back. But sometimes that first analysis is really painful. And you might have to you might have to cut out that laser you were going to buy next year in your budget because you're not really paying your team fairly and you need to increase some people by several dollars. So just make sure you understand that. And I always recommend talking to your accountant to understand the true tax portion of that. I
Yeah.
help my clients with that part of it, but we don't realize a dollar is not a dollar an hour. You have to pay matching payroll taxes on that. So
Yes. Yes.
$1 is not $1. And sometimes doctors get into that and then they're like, why is my payroll percentage so high? And I'm like, because you're giving, $4 every time you think you're giving three.
Well, and you think too, the fact is we need to focus on other things too. Like the dollar amount is just one. Like your true compensation, what is, I mean, if you give an allowance for scrubs, they're scrubs. How much are you giving them a year in CE? And if it's somebody in a licensed position and you offer to do other things for them, like maybe maintain their license or whatever, or insurance, that factors into it. But for just unlicensed staff, you've got to look at everything: vacation, paid time off. Like it's not just the dollar. And unless you've sat down with someone and really looked at that, that is a very shocking theory, like something to wrap your head around. And then as far as COLA, cost of living adjustment, so it's usually like anywhere between like the 2 to 5%. It depends on, what's going on in the economy. But if we've got a lot of inflation, if inflation is like at 8%, cost of living's at 5%, people are still down at like -3, right? So I don't want to complicate it too much, but what you said about talking to an expert, like you have experience with this, CPAs have experience with this. Don't just go, well, the economy's rough. Let me just no, we need to really look at it. And then the impact on taxes, your quarterly taxes too. Like you don't want to be taken by surprise. You said something that I think is some doctors are going to recoil. Like you said, maybe you don't get the laser because you're not paying right. And I'm thinking to myself,
They're
that
going to
makes
hit you.
sense to me because I've seen it, right? Like we've
Mhm.
seen it. But a doctor's like, wait a second, because I know this thought process. If I get the laser, I can have more coming in. But if you have a staff that's not happy, maybe there's turnover, all the toys in the world, right? Like I've walked in offices, you walked in offices where like they got super expensive stuff they bought and it's just sitting there. So
Mhm.
yeah, I get what you're saying, but I imagine like some dentists going, oh, my laser, don't take my laser.
Don't take my laser. And there are some times where I have to do that math with doctors, like Cerex, for example, or E4Ds, or I don't know if they have E4Ds anymore, but Cerex, when they're doing same day dentistry, sometimes that math makes sense, right? So I think it's all about not just getting excited, and our sales reps are really great friends and allies, but
Hmm.
sometimes they throw out numbers
Yep.
of like, oh, doctor, well, this will pay for itself. It will, but are you feed appropriately? Are you charging out the codes that you're supposed to charge out? Like, are you doing what you're supposed to do? I just had a conversation with a doctor the other day about the centrifuge, right? Like,
Mm.
yeah, it's super cheap, but like, is it even worth the $800 if you're not charging for it for PRP? So,
Interesting.
just making sure that when you look at those toys and we're getting into it, like, does the cost analysis make sense? And are you really going to be making money off of it? And if it's something that you're like, no, but it's a value add for my patient, that's great, but let's make sure it fits within your budget. Don't cut out, being able to afford to pay your team members appropriately
Yeah.
or, being able to do things and to stay in compliance because we just want a new toy, which I
Right.
know it's hard to hear.
I know. We do love our toys, though. Everybody loves
We
their
do.
toys.
We do. So I help them budget to get those toys.
Right, it's a goal. It's now a
Yeah.
goal.
It's now a goal. Yeah.
Let's talk about transitions and associates because you have a lot of experience with this.
Yeah.
And I know a big pain point across the board. I always saw it as a pain point for doctors integrating an associate, but the more I spend time with management talking to other managers, the associate is a pain point for the manager too, because now the manager does not realize like her or his work now doubles. And she may have been babysitting one doctor. Now she's babysitting an even younger, less experienced doctor. And I feel like I was always concentrating on the veteran doctor, like mentoring and making sure that associate stuck. But man, I forgot all about the manager and how stressed out they get with an associate. So can you talk a little bit about integrating an associate into the office, maybe from a dentist point of view, but also the manager's point of view, because it's tough out there.
Yeah, it really is. I help a lot of doctors with this. Again, it comes back to planning. Obviously, I'm a huge fan of huddles and chart prep because I'm going to say this, but I think that the more that you do ahead of time, the smoother things are going to go, right? And so making sure one, before we add an associate, do we know how many days we actually need support with? Like, does our patient base support it? To
Mhm,
bring one on, if you're bringing on an associate because you wanted to step back more, can we condense your production so you're still making the same amount of money with your current patient base?
mhm.
Or does that mean you're giving up production and income to bring somebody on?
Yeah.
Those are the two biggest things that I find that people don't prepare for ahead of time. And then they get frustrated because they bring somebody in and they're like, oh, this associate's just sitting around and they have student loans to pay. And they're like, I'm getting paid on production or collections and I'm not making money. I can't afford to stay.
Mhm.
Or the existing doctor is like, well, I don't want them to take all my patients. Well, we could have planned for that, right? So
Right, right.
the planning stage is the most important. And then I do think it comes down to so many associates. They understand now the difference in like corporate dentistry, which I do think there are some great corporate groups out there.
Sure.
But that model of I'm going to go and I'm going to work by myself in a practice and I'm going to have this practice from day one and I'm going to just be busy all the time. A lot of the new doctors that we see actually want mentorship. So they really love
Yeah.
the private practice. They want to go to somebody that's the best of the best in their field and has grown a really successful practice and learn from them.
Mhm.
And so when we talk about associate integration, it's also before you hire somebody, asking the right questions, making sure it's a fit with your vision, where you want the practice to go, your core beliefs, and then also clinical beliefs. So I always have my doctors do like a really in-depth clinical review
Mhm.
before you hire the associate, not after.
Okay, so walk
Um,
through that. What does that mean? When you say clinical review, you talking about charts? Are you talking about service mix?
Yeah, so really both, like figuring out what they're comfortable doing, what they want to do more of.
Mhm.
Sometimes that's not a conversation, and we assume we're going to bring on an associate and they're just going to do all of our resins and all of our,
Oh, yeah.
crowns for us and all of our prophy checks. And we're just going to have the best life. And we're going to do implant placement all day and just
Yeah,
chill.
yeah.
And what ends up happening is the associate comes on and they had a goal of doing implants themselves, right? Maybe they took an advanced course in college and they're
Sure.
really excited about doing more implants. And so understanding what is their goal versus what is your goal and does that align? But then also in that clinical review, doing some cases. I usually say do it first to see where they're at so you can get a base to see if you're comfortable. And then as an ongoing practice, when you first bring them in, I want you sitting down every week, at least once a week with your new associate, looking at their treatment plans. Let's look at the case. Let's pull up the x-rays. How did you diagnose? Why did you diagnose this way? What are your thoughts? We can do that in the interview process to see where they're at initially versus your technique of how you treatment plan. And then as you start to go on, that moves to a monthly visit or a monthly meeting and then a quarterly, after a year where you're like, hey, we're just going to sit down once a quarter.
Yeah.
Because what you don't want to happen is you bring an associate on and he or she treatment plans different than the owner doctor. who
Yeah.
maybe is not retiring right away. And now
Right.
you have a really awkward phase out. So you
Yeah.
want to make sure that it's really comfortable, whether you're bringing somebody on because you're wanting to grow your practice or you're bringing somebody on in plans of transitioning. You want to make sure you're just in alignment because nobody wants to feel disrespected, especially by, even though technically you're hiring them, you're still kind of a colleague
Yeah.
as a
Oh, yeah.
provider,
Yeah.
and they look for you to grow for growth. So just
Yeah.
having that respectable communication.
That associate power dynamic is so hard though, because I see two things. I've noticed that the associate will come in and they feel like I'm the dentist and the staff now works for me too. Then you have the associate that comes in and has no idea where they stand in the practice. And then they get basically run around like the team runs the doctor, like new dentists, because the doctor may have said, okay, they're new, they don't know what they're doing, we need to take care of them. So now this team is babying this doctor. And there's like not a lot of respect assigned to that new dentist, which is not a great way to start your career and
Yeah.
hone leadership, right? But the opposite is when, like I said before, like a dentist will come in and be like, I'm the associate, this is now my staff. That's
Mhm.
not a good way to start off, too, with an existing, really cohesive staff already. Like you're now coming in and I don't know, it's like Cruella de Vil kind of walking into the office. So, how do we avoid those two extremes?
Again, I think it comes back to the interview process.
Sure.
Like, can you share with me how you communicate with the team? Like, you know, even bringing them in to meet the team and letting them know, like, here's how I manage, here's how I operate as an owner and with my manager, even bringing the manager in to meet
Mhm.
them. And then talking about what is that dynamic going to look like after? Like, here's what I would love for you to, you know, so and so manager is going to help you with your numbers and making sure that you're staying on track and helping you with your scheduling templates. And we're going to make sure that you have what you need. But please feel free to reach out to them if you have any concerns or there's anything you want adjusted, and then I'll help you on the clinical side, right? So if you can set up that mutual respect in the beginning, I think that takes away a lot of it. But sometimes I find that doctors, you were asking about managers earlier, like doctors don't set that up with the associates. So the associates think I'm above the manager
Mm,
when really they're kind of equal but opposite, if that makes sense. Like
yeah.
they're on the clinical side, but the manager is in charge of the team and the operation. So making sure that it's comfortable. And I think the attitude of I'm going to come in and I'm going to own the practice, a lot of times those doctors I find they come in feeling like there's a lot of pressure because they're usually left alone. Those are the doctors I find that they're like, I'm here, the other doctor's gone 3 days a week. I'm here by
Um,
myself 3 days a week. So I
yeah.
have to establish respect immediately. And for those doctors, I would just say, you know, just take a lot of time, deep breaths, rely on your team, but also don't tolerate disrespect, right? If somebody is being disrespectful to you, there's lots of communication tips out there we could talk through of like, hey, you know, if
Mhm.
somebody is coming to you, or you can even look it up online, like, how should you respond in this situation? But my favorite is just, you know, hey, like, thank you for bringing that to my attention. Let me think about that and get back with you, right? But you
Mhm.
don't have to react in the moment and be very frustrated and demand respect. You can think through that and how you want to respond. But yeah, I find that most of the time that cultural fit in the beginning is so important in the interview process that you can weed out a lot of people that maybe are not the right fit for the personality of the office.
Well, and so when you're saying like what's your conversation style, what's your leadership style? I feel like when you're hiring an associate for the first time, you don't even think to ask that question. I feel like you ask that question when you've been burned. Like usually the second or third time around, you're like, I'm asking all this stuff because this is everything that went wrong. So if
Yeah.
you're an associate and you're sitting for an interview and you get all these questions about how do you act with this, that's them giving you a heads up there was an issue before. It doesn't mean it's bad. It's just like they now want to make sure like you're going to be a good fit. I feel like if it's your very first time hiring an associate, that stuff just kind of you expect it to happen, especially if you have a good team. You're kind of like, oh, it hasn't been
Mhm.
a problem. Why wouldn't they assimilate? Like, why wouldn't they fit in? And that's really hard. You actually have a whole system for associate integration. We were talking about that in the
Mhm.
pregame because it's so important. So many associateships don't work, and it's really sad. I mean, I
Mhm.
think the number that gets thrown around a lot is 50% don't work. I mean, I don't know if that's true or not, but that's the
Yeah.
number I've always heard. Have you seen that be true of not maybe not for your clients, but have you seen that true
Mhm.
in the industry or do you think it's getting better?
I do. I think it's an issue. I think there are certain states that struggle on a whole different note, like they hire associates. And I say a different note, but it's kind of the same issue. The more frequent failures in terms of associate integration that we see are usually because of a misalignment of expectations in the beginning. beginning. And so sometimes there are states right now where they're struggling with hygienists. So they'll bring in an associate, not tell them they're going to do hygiene,
Oh,
stick
geez.
them in hygiene for 3 days a week. And then the associate's not making enough to pay their student loans and has to leave.
It's not cool.
No, I
That's
mean,
not cool.
think about it from your perspective. Like, how upset would you be if you, for whatever reason, left your practice, you weren't working for your practice, you went to work for somebody else, and they misrepresented what they were going to be doing? So that's a big piece of it. But then I think that also, like we talked about earlier, it also translates to you brought me on. I thought I was going to be able to grow and learn from you, but you're gone 3 days a week and you're taking all the implants and the big cases, and I'm only allowed to do resins and crowns, and I'm not growing. For some associates, that might be what they love to do. And it might even be on a plan. Like right now, I have some doctors where I'm like, hey, you might not want to do all this in year one. Like they need to hone, if they're
Mhm.
fresh out of school, they need to hone their skills, right? They
Yes.
need to do a lot of crown preps. They need to be efficient at resins. They need to be able to do all of these things. And then let's make a plan for year two. We're going to send them to some advanced courses. We're going to invest in them, invest in the practice,
Mhm.
and help them reach whatever goal they have. So a lot of the failures I see are either miscommunications. I see a lot of doctors that still don't do contracts, which blows my mind.
Yes, we just had Dr. Emery
Blows my mind.
Patel, I'm sorry, on, and she said the same thing, like, "Why are you even going in?" And you never have anybody look
Yeah.
at a contract if you do get a contract. So, like,
Yeah.
please, people, it blows our mind. I mean, I can't even
Yeah.
say it more.
Yeah. I work with a lot of doctors where I'll help them in that process of mediation on terms of, hey guys, here's what we're agreeing to the terms. But then you take it to your attorney, they draft it up, and then you guys agree upon it, right? Because, and I always tell the associate, you should also have this reviewed by your own
Mhm.
attorney, not
Yes.
the attorney of the doctor that you're coming in for,
Yes,
because
yes.
you want to make sure you're protected, but also those usually spell out a lot of the issues that we come into later. Like, how are we handling remakes? Does that, how are we handling lab fees? Does that come out of the production or collection percentage you're being paid? Some of those other situations. If you want to leave, how much advance notice do you have to give? And some
Mm,
doctors are really frustrated because they're like, they only gave me a month. Well, you didn't have a contract and they can do that, right?
right, right. You're
So
probably
just
lucky you got a month.
you're very lucky a month, right? So, yeah, I think just being really aware of, every partnership, just like if you were to go buy a practice with somebody or enter into a partnership in any business,
Mhm.
you want to talk about the end at the beginning when you're friends, not at the end when you're frustrated, right? So, and hopefully if you talk about the beginning, you don't have to be frustrated at the end of that agreement if it does come to an end. And then the other thing that I find is that doctors, I think that for most associates, again, talking about their goals, most associates are going to be happy long term. But, and this doesn't just apply to associates, this is all team members. For some reason in dentistry, because there were so many good old practices back in the day where everybody worked there for 40 years and then
Yeah.
retired, for some reason we have this expectation of all of our team members that this is a permanent position for you,
Mm, mhm.
including our associates. So figuring out like what are your goals and supporting them. I think if you shift your mindset in your mind that it's not always bad when a team member leaves or an associate goes to open their own practice, like
Sure.
how cool is it that you as a leader help develop somebody and help them reach their dreams, right?
Yes,
Like
yes.
that is, I'm getting like excited because that's like my favorite part of the role. Like
Yeah.
it's so fun. But if we look at it like, oh, I hired an associate and their goal is to open a practice one day, I'm never going to talk to them. Well, they might be a great fit for you for 5 years and then they go off on their own and then you have a great referral relationship. Maybe you do procedures they don't.
Yeah,
Um,
absolutely.
but if you're looking for somebody to transition, yeah, you probably want to find somebody that is interested in buying your practice. If they say, I don't ever want to own a practice, probably not the right fit for that initial hire.
It's a good philosophy. I mean, you can't expect everybody to stay with you, like, long
Mhm.
term. People, and there's things beyond your control, like some of the areas that are near naval bases or Air Force bases or Army bases. I hear this all the time. She was great, and then they got transferred. And it
Yeah.
happens all the time, so you can't, like, this one person cannot be what you tie your practice to, whether it's an
Mhm.
associate or a manager or whatever. Like, the owner is the permanent
Yeah.
part of the practice. Everything else is just gravy. Like, if they stay for a long time, fantastic. You've been blessed. You are a great leader, like you said. But, you do need to worry if, like, it is a rotating door, there's something
Mhm.
going on there. But people do leave. They just
Yeah.
leave. If you have somebody, I see this a lot too. And I, of course, you and I experience this ourselves. When you're working and you have other things that you want to do, I mean, you might have a Teresa or Olivia in your office and they're probably going to leave eventually because there's
Mhm.
something else they want to do or they see
Yeah.
something higher they want to get to. It's no reflection on you as a leader. It's just that we spent our ambitious time with you. Now we're going to go spend ambitious time over here. But I see that a lot with doctors like, yeah, she was great. Now she's a consultant. And I'm like, oh, and they're like, yeah, but I think it's awesome. But they're like, she's out there helping others and she was so good here. And they're not, I don't feel like they're upset. They're more just like, like
Yeah.
I trained her and she went somewhere else. But to
Yeah.
that point, like you said, like how cool of a leader is it? You enabled her to run that office so well that she
Mhm.
saw what excellence looks like and
Yeah.
wanted to go out and do it herself. Like that's how I would look at it. But from an owner, I can kind of get it.
Yeah, I always tell everybody, like, I was so blessed to work in a practice with a doctor who would show me the x-rays and show me why he was diagnosing. And like, when I talk to doctors now, I try to pass that on of like, if you want a really great treatment coordinator, don't treat them like you're just presenting treatment. Show them why you're saying that that
Hmm.
has to be a crown instead of a resin. Show them why, like, here's the crack. This is why we need to extract that tooth and it's not savable, because they're going to repeat that verbatim to the patient after you leave the room.
Yeah.
And again, the patient needs to hear it so many times. But yeah, to your point, I tell everybody, like, how cool is it that he invested in me and let me do, I mean, he let me hire whatever consultants I wanted to bring on. I learned from some of the best consultants in the industry
Yeah.
because he let me really run the practice and really give my input and run with it. And not everybody's going to want to do that. I have team members that say, I love being, the patient care coordinator receptionist that comes in the practice and everybody sees me.
Yeah.
And that's so cool that you have that person that will be there forever. But if we have somebody that really does want to grow, don't hold them back, including
Yeah.
associates, right? Like, how cool is it that you get to be part of that journey? So,
Yeah, it is funny. We do talk about it. He's like, "Yeah, worst thing I did was take you to CE," and he laughs about it. We're still good friends. We're Christmas party tomorrow, so it is what it is. So we had really good relationships, and like you said, it sounds like you hooked into a very similar type of employer that was just very generous with knowledge, and I'm always going to be thankful for that, and I always try to carry it forward. So let's tackle the manager topic, and then we'll wrap up. You have for your existing clients, you do this office manager training where you really focus on the office manager. And I know you can do it separately, but really it's more for your clients. And if you catch Olivia when she's, got a lull in clients, maybe she'll do it, but she's pretty busy. So she saves that kind of for her clients. Walk me through not the training, but what you're seeing nowadays with managers. Where do you see that? Like when you started doing it, was there an area you focused on? Has that changed? I mean, has the demands of being a manager changed in your time period of offering these services?
I think that it has changed, but it's also still the same in the
Hmm.
sense that, and I work with managers on all different levels. So it might be different, and my training is customized to where they're at right now. So it might be focused on for a new manager, do you understand KPIs? Do you
Yeah.
understand the numbers of the practice? Do you understand what recare means? Do you understand what metrics we're trying to hit with AR? What are some flags that you should be looking out for? Audits that need to happen on a consistent basis to protect the practice, putting in checks and balances, things like that. Whereas for an advanced leader, I might focus more on growth plans and employee retention and what's important to them. And sometimes it's communication skills. I have several teams that I'll spend a lot of manager training time on how they're communicating with the doctors and the culture of the practice so that we can help them reach their next level as a manager too and what they need to do. That's usually probably, I think, the part where a lot of managers get stuck. There's a lot of training out there for managers, but it's really figuring out, okay, if I was at the front desk, I would consider an office manager where I'm seeing patients, checking people in and out, helping, versus a practice administrator that's not really working in the business, but's running the business, or an
Yeah.
operations person
Yeah.
for a larger practice. That transition is a lot of the training I'll work with too, of how do I go from being at the front desk and obviously being doctor's right hand and helping with all payroll and all this other stuff, but I'm really focused on the patients coming in. Now my focus is on the team and the operations and the growth of the practice. So that's the fun part of like, how does that transition happen? And what are your new daily things you should be focusing on? And how are you going to have that shift? But I find a lot of people still struggle with that part. And that's where doctors will hire in new managers from outside because the transition didn't work. And now they're letting go of their office manager who has been a great team member for 20 years or whatever, right?
Mhm.
Because
Oh,
they just couldn't grow with the practice. So
right.
a lot of
Oh.
them helping with those situations too.
Well, it is hard. I mean, when you're excellent at one job and then you're asked to stretch and maybe in a direction you probably wouldn't have gone yourself.
Mhm.
Now you're like a fish out of water. And I think from what I hear from people is I feel like everybody's watching me screw up. Like,
Yep.
even though nobody really can see it, like
Yeah.
I'm not handling this as well as I could have. They're used to me doing this and I don't know what I'm doing. And that feeling of I don't know what I'm doing when you're the office person in the office that needs to know what she's doing, that's tough,
It's
right?
scary.
That's
Yeah.
really tough. I think it's okay to say, "You know what? Maybe I'm not cut out for this. Maybe I'm good for an admin lead and not
Yeah.
operations." Operations, you have to engage different parts of your brain that when you're doing stuff tactically every day, it's like your lizard brain kicks in. Like
Mhm.
when you drive, for people that haven't heard that, like basically like stuff you do on autopilot. Like that's why you end up at the office in the morning and you don't even remember the drive. It's like you just kind of went into
Yeah.
autopilot. When you're checking out patients, answering the phone, like you do that every day, all day, like, every day feels the same even though it's different,
Yeah.
but when you're in operations, like, you gotta really, like, kick in analytics, and if you're not used to that on a regular basis, that can be kind of humbling, I think.
Mhm. Yeah.
So
Yeah, and I teach a lot of that, like how to analyze, how to understand on a different level in that training on one-on-one. But what I find is it helps to know, again, it's customized to every practice. Like, what are the things that you're needing? What are your responsibilities going to be? And I do think that that's a big area for a lot of doctors and owners to realize, like, you need to communicate what your expectations are, especially if you're promoting somebody into a manager and whether that's an office manager and you expect them to help with payroll and sitting in on meetings with you with the team and managing schedules, or
mhm,
it's a practice administrator where you're like, I want you to just run everything. What is that level of autonomy that you're willing to give up? Because the ones that I see that don't work out well, just like the associate integrations, the management transitions I see that don't work out well are often because we didn't clearly communicate our expectations. And now we're frustrated that so and so just pulled somebody in the office and got onto them about something when we're like, well, I wouldn't have handled it that way. Okay,
right.
but
Yep.
they're developing, right? So now you have also become now a mentor to the manager if you're wanting to develop them. So
Yeah.
for the managers, I agree with you. Feel like you're not alone. I know it feels like an island. There are so many people out there that are willing to help you and coach you and help, be there for you. Just be open to it. And again, like Teresa said, if it's not the right fit,
Yeah.
don't feel like you have to do it. But then for the doctors, like be willing to be that mentor, be willing to have patience and give clear expectations and help them grow.
Yeah, that
Yeah.
whole level setting, expectation level setting, I mean, it's been kind of the theme through this whole, conversation, but it's so important, and if you don't know what your expectations are, then you need to talk to somebody to find out what it is, right? And then if you're
Mhm.
not comfortable doing it with the team, find somebody that can help you do it, right? So
Are you a dental biller feeling overwhelmed and isolated? I get it. The world of revenue cycle management is complex and ever changing. That's why I created Dental Revenue Network. Our membership community was created to help you become a better revenue cycle manager and small business operator. Say goodbye to feeling alone and hello to a supportive community of dental billing professionals. Here's what you'll get: monthly billing focused meetings with peers and experts, business building sessions to elevate your career, resource libraries tailored for billers and billing company owners, introductions to cutting edge RCM technologies and companies, and a vibrant community for networking and support. Ready to transform your dental billing experience? Visit dentalrevenuenetwork.com today. Don't wait. Join us now and navigate the business of RCM with confidence.
I do feel like dentists now are seeking help more than they were before. I do
Mhm.
feel that, and
Yeah.
maybe social media has helped or just visibility or whatever, but when I was coming up, when you were still in college, it was like a dentist asking for a consultant was almost like an admission that they weren't running it well, and
Mhm.
that's drastically changed, thank God. So, if you've never worked with a consultant, maybe dip your toe in the water. Olivia is so easy to talk to, as you can tell, so give her
Mhm.
a call, but yeah, you don't need to do it alone for sure. So, how do they reach you? How do they get in touch with you?
Yeah, you can reach out to me, my website, osdentalconsulting.com, or you can email me. It's olivia at osdentalconsulting.com.
Okay.
I'm happy to chat. I have a lot of people call me just with random questions or wanting to find out more. I'm happy to, see if it's a right fit. And to Teresa's point, I've worked with coaches in the past that have not been the right fit for a practice, and that's okay, right? It's a
Mhm.
personality thing. So if for whatever reason you have looked at consulting in the past, you're like, it didn't work, that doesn't mean it won't work in the future for you. I think you have to be in the right place and it has to be the right fit. So I'm always happy to talk if anyone has questions.
There you go. And if for some reason, if you're like not vibing with Olivia, and like same when I get on a consult, I'm like, we're not really vibing, but I know exactly who could work with you. Like we
Yes.
know other consultants whose consulting style is, I mean, consulting styles are different. Not
Yeah.
everybody consults the same. So if you are a type of dentist that needs like, really hands-on, like super hands-on, like mommy style, maybe we know someone. But I also know there's some dentists that just need to get their butts kicked like regularly. Like that's how they're going to respond. That is not what I do. I don't think that's what you do,
I don't kick people's butts, to be clear.
but I know butt kickers. So, what I'm saying is Olivia and I know enough people that
We'll
we'll
help
find
you.
you who can help you.
Find you the right person.
All right. Well, dear listeners, thank you so much for listening, Olivia, so much. I really appreciate this conversation. It's nice to really kind of go back to management for a little bit. We've been so RCM focused, so it was a really nice break. Thank you so much, and we'll make sure all your information is in the show notes. And dear listeners, as always, I so appreciate that you spend your time with me.
If you learned something new today, subscribing is the best way to support the channel and keep learning with us.
We're all super busy, so thank you for making time for me today. The show notes will have any links that we referenced in the episode. You can also find links for my book, events, and my online insurance course, Dental Insurance Design and Management. I speak often around the country on management and insurance issues. Come hang out with me in one of my classes. I promise you'll laugh and learn.